placenta, sudden separation of placenta from its normal situation. That means the blood supply to the baby is cut off and all that. So that means the baby will first of all show us sign. But it's just like, how will I put it? You are strangulated. First of all, you are so scared. At the end of the day, if you cannot fight it back, then your pulse rate will go down. And if there's no intervention, as in the strangulation doesn't stop, and then that is it. Person is gone. That's what we call hypoxia, fetal hypoxia, and baby dies. So these are all the things we try to avoid during the course of labor.
And all of these reasons that you've given, looking at it, they're genuine enough. So why would, a woman or perhaps her family members want to reject cesarean section?
Well, there are some, I don't know, this is just our culture, as I found out. There was, because the fear of cesarean section for one, the fact that you are going to go through the surgery, the fact that you are going to be cut through, and all of that. And apart from that, the fact that it is even seen in some cultures here that for you not to have achieved a vaginal delivery means that you are not a woman. You understand that you have not proven yourself, you are a weakling. Some people see it like that, and it's down there. And apart from that, there are a lot of things that religion too has to play now, that your pastor, your spiritual leader will have reassured you concerning the pregnancy that you're going to deliver yourself. And so when we come and tell you that we need to intervene, then you're taken aback. It can't be. That none of your family members have had cesarean section before. My mother delivered all by herself. Even when your mother is even there reassuring and all that she can deliver herself. And then we find it to have to start counseling before we get the consent to go ahead.
Okay, but there are times that people feel that, okay, maybe the woman should have been given a little more time and she's going to have the baby by herself.
Yeah.
And that's why they don't, want to take on this CS.
Yes. Yeah, the truth of matter is
hurriedly, taking the woman into the theater.
I think in a very good practice, that doesn't happen. Because when a woman is in labor, alongside with the relatives, you should be taking them along on the course of what is happening. There's a period of the labor that we call the latent phase. And this period may last for a long time, like 8 hours and all that. And by the time a woman steps into the labor ward, everybody assumes that, yes, labor has started. Meanwhile, there's still this latent phase that we are waiting before she gets into the active phase of labor and all that. So by the time the relatives are started calculating, they are calculating from that time. And when we start seeing her, maybe it's even the period of latent phase that we find that there's something going on, like the fetal distress I said initially. And then when she's in active phase and all that, we try to take them along, But by the time we are talking about giving, if there's anybody that should give time to be sure that this patient needs a cesarean section, I think it should come from the side of the doctor, not even the relative. Because by the time the doctor comes out and says, I think this patient has to be delivered by cesarean section, that means he or she knows what she's doing. By the time we are asking for more time, then that means the critical period. All this I'm talking about in cases of emergency. Okay. You understand?
Okay.
I said earlier too that we have elective cases, that a patient with, for instance, severe preeclampsia, some patients with placenta previa, that's when the placenta is coming before the baby. In such situation, if you allow the woman to deliver, she's going to bleed. And that's what we call, she's going to be prone to postpartum hemorrhage. Initially, she may even have antepartum hemorrhage, that's bleeding during the pregnancy. And if it's not taken care of, it could progress to, after delivery, she's going to bleed so much, which can even result to death. So if you see that early enough in the pregnancy, that means towards the time she's going to deliver, you have to offer cesarean section, whatever type of placenta previa it is. Then at times, even the liquor may be so little. That's what we call oligohydramnios. This is a sign that the baby is not fine. Because what that amniotic fluid does is that the baby is supposed to swallow and urinate into the same fluid. And so if we are not making fluid, it's just like something like what happens to us, that the kidneys may be failing. So we have to intervene and let's know what is happening so that we can quickly hand over this baby to the pediatrician and the baby will be well evaluated. So these are some of the cases where we ask for CS electively. Electively means that we may not even wait for 40 weeks. By the time she's getting to 37 weeks, we're talking about, at times, as soon as the baby has passed 28 weeks, as I said earlier, and there's some issues coming up, then we have to look critically and we may have to offer cesarean section.
Okay, and step in. All right, we'll just take a quick break, and when we come back, we'll be looking into what the woman should know before and after cesarean section. Do stay with us on the program.
Every day you invite us to your home. Now we invite you to our homepage. Join Channels TV on social media. Hang out with us on Google Plus/Channels Television. Follow us on Twitter.com/Channels TV_NG. Friend us on Facebook.com/Channels Forum. And don't forget to like our page. That's not all. Subscribe to our YouTube channels, youtube.com/Channels Web, to get post and video updates on news and events in Nigeria and around the world. ChannelsTV.com, the news at your fingertips.
Thanks for staying with us. You're watching Health Matters on Channels Television, and you can join us in the discussion on cesarean section, the facts and the myths. You can call us on 018923900, or you tweet at yourme_Otagbe. We were talking about some reasons why people reject this cesarean section, and this comes to my mind that sometimes perhaps women go into this, go into the theater for this surgery, and they never come back alive.
Yeah.
Or sometimes the baby is even lost in the process.
Yes, I won't tell you that we don't have such situations. Those situations actually arise, and there are some of the complications we even dread as doctors. But I think we've gone past that. Medicine has advanced so much, and we need to be knowledgeable about that. In the past, the fear was about anesthesia. Pains during the surgery and all that, but we even have gone as far as before it was all our patients having to go through general anesthesia. Now most times they are offering spinal anesthesia, and even epidural now. That means it's just an injection at the back, and then you wouldn't feel pain from your umbilicus down to your leg, and you wouldn't even know anybody's touching you. The only thing you will in fact be involved with the surgery. By the time the baby comes out, you hear your baby cry. Your doctor is even talking to you. That is the surgeon and all that. The anesthetist is making you comfortable. And then in the past too, we were bothered about antibiotics. Then after the cesarean section, that was when it emanated from, as in those days. We know that we have a lot of infections to battle with and all that, but we have so many antibiotics, very good one. Generations of antibiotics have come along with time, and then we are comfortable with it and all that. So these are some of the things that brings fear. But we should know that medicine has advanced, even in Nigeria.
Okay.
More than that.
We have a caller. Nkechi is calling us from Abuja. Hello.
Hello, good morning.
Thank you for joining us.
Hello.
Go ahead, please. We can hear you. Go ahead.
Okay, I have a friend who died of cesarean section just recently. So I just want to find out, what do you think could be responsible for such?
Okay,
That is one. Then secondly, why do people ask for it on their own?
Okay, why do people ask for it on their own?
Yeah.
All right, thank you.
Yeah. Yes, as I said and admitted to, it happens. We have some of the losses from cesarean section because of the complications. All of our procedures in medicine have complications. And some of the complications we divided into three. It can be as a result of hemorrhage, it can be as a result of infection, and it can be as a result of anesthesia. Surgery is you have to cut in through vessels and then you bleed. And that's why I will tell you that the skills has improved from where we started from. And these are things we take into cognizance. But we can have situations like antepartum hemorrhage. You can either be from placenta previa or from abruptio placenta and all that. It could be so bloody surgery, and in that case there must be a support. That means that you must have a blood bank support and all that to transfuse. And if intervention is not good, is not given at times, then we can lose the patient. But in the course of hemorrhage, course of the surgery, there's some things that could happen, reactionary hemorrhage, these are some of the complications that could happen. But the point is that when these things are detected, then we can intervene. Then we have from anesthesia itself, even though we have the epidural, we have the general anesthesia, there could still be some complications that can arise from that. And it's very important.
What's the percentage like? Maybe we should get that clear now.
Well, I may not be able to give a good percentage, but I'll let you know that the percentage is right minimal from where we are coming from. Because it is always when a mother dies from delivery, it's very pathetic. And we usually set up inquiry to know why, because it is not proper for a woman to die because she wants to